Gout is the most common inflammatory arthritis of the joints. So, gout is caused because of high level of uric acid in the blood. So, the high level of when uric acid level increases in the blood, it goes and deposits in your joints, and where it causes inflammation. And when this inflammation happens and there is pain and swelling in the joints, this is called gout. There is an enzyme called uricase, which helps uric acid to flush out from our body. So humans don't have this enzyme called uricase, and that's why we have the tendency to get a high level of uric acid in our blood, and which then leads to deposition of uric acid in the joints, and it can lead to gout. So especially males are more prone to getting gout because in females there are estrogen hormones which help in flushing out the uric acid from the body, and that's why females below 60 years of age, they don't get gout. Females can get gout only after menopause, maybe after 60 years of age. Gout usually starts with first joint of your toe, the base of the thumb. Patient is usually like he's gone to bed and he's okay the night before, but suddenly he wakes up in the midnight or early morning and he has severe pain in his feet and he's unable to walk. So this is how gout presents itself. So the gold standard to diagnose gout is to aspirate the joint, and we check uric acid crystals in the joint fluid under a microscope. So this is the main test which we use to diagnose gout. Apart from that, we also monitor uric acid levels in the patients of gout. Gout is managed in two stages. First is acute stage. Now, in acute stage of gout, we use anti-inflammatory medications to reduce the inflammation of the joint. We sometimes use low-dose steroids to control the inflammation. And then once the acute attack subsides, if the patient is prone to getting number of attacks every year, like more than 2 or 3 attacks if the patient is getting every year, we put him on uric acid lowering medications to prevent further attacks. Patients are supposed to avoid high purine foods, foods which contain high amount of purine in their content, which are red meat. They should avoid seafood because seafood is known to have high purine content. Patients can eat chicken and eggs in non-veg food. They can have all the vegetarian protein sources like dal, peas, paneer, etc. Again, a very important thing to avoid for gout patients is alcohol, and especially beer, because beer has high content of purine, and which can increase the uric acid level of the patient, and it can lead to gout attack. Patients should also avoid foods which have high sugar content, excess sweet, excess fruit juices or canned juices, colas, cold drinks, and all they should avoid. They should avoid excess caffeine also because caffeine leads to dehydration. And patients should be drinking plenty of water. They can include milk and fruits in their diet. Patients can have healthy vegetarian food. So all those patients can. So if gout remains untreated, it can damage your joints. It can lead to a lot of deformities in the joint. And if gout is untreated, it can eventually, high uric acid level can eventually affect kidneys of the gout, and patient can have chronic kidney disease.